So the next test is Thomas test. It's for testing the hip flexor tightness. So the patient is asked to lie down, and if you want to test the affected side, let us say this is the left hand side of this patient is affected side. So we want to test the hip flexor tightness of the left leg. So for this, the client is asked to flex the knee and hip and asked to directly close the knee towards his chest. So what happens here is, so there is a posterior pelvic tilt of the of this client, and you can also see that is the lumbar spine is totally flattened. So only this helps to identify if there is any hip flexor tightness. Suppose if the leg is brought down, the pelvis is posteriorly tilted, and so the hip flexor tightness cannot be identified. So this is a very, very important component of the test. So now, so in this case, there is no hip flexor tightness. You can see that. Suppose if there is a hip flexor tightness, you will see the patient having a hip flexion in the affected leg. So to confirm the hip flexor tightness, it is very important for you to try and press it down to find what is the end field. So it needs to be a leathery end field for muscle tightness. In case if there is a bony end field, then it's possibly because of the joint tightness, or there is the decrease in range of motion of the particular joint. So you need to have a leathery end field to find if there is a tightness in the hip flexors.